All right, so today we're doing a deep dive into something really interesting.
Yeah.
Ivermectin as an anti-cancer treatment.
Interesting.
And this is something that I saw, kind of going around online, people talking about it,
Right.
and then saw a video by Dr. John Campbell
Yeah.
where he was talking about a paper
Yeah.
that came out of China.
Mm-hmm.
And so those are the sources that we're using for this deep dive today. And basically, it's this idea that ivermectin could potentially be used to treat cancer, which,
It's very interesting.
you think of ivermectin as this kind of, controversial
That's right.
drug that people were taking for COVID.
Yeah.
And I think that's probably why it's become a little bit controversial, because there was so much, people talking about it,
Yeah.
using it for COVID. Some people saying it was a miracle cure, other people saying it was dangerous.
Right.
And so now it's kind of gotten this reputation of being this weird drug.
Yeah.
But so in this paper that Dr. Campbell was talking about, the researchers suggest that ivermectin may fight cancer by inducing something called apoptosis.
Right.
Activating a process called autophagy.
Okay.
And triggering cell death through things called inflammasomes.
Interesting.
So, I know that's
all big words.
a mouthful.
Yeah.
Can you kind of just explain what each of those things are?
Yeah. So apoptosis basically means programmed cell death.
All right.
It's when the cell basically decides to just die.
Mm-hmm.
And this is actually a very important process in the body because it gets rid of cells that are damaged or no longer needed.
Okay.
And so in the context of cancer, apoptosis is really important because it can help to kill cancer cells.
Right.
So if ivermectin can induce apoptosis in cancer cells, that would be a really good thing.
Hmm.
And then autophagy is basically like a cellular recycling process.
Yeah.
It's when the cell breaks down and recycles its own components. And this is important for maintaining cellular health. And it can also help to suppress tumor growth.
Okay.
So if ivermectin can activate autophagy in cancer cells, that would also be a good thing.
Got it. And then what about these inflammasomes?
So inflammasomes are basically like danger sensors in the cell.
Okay.
They detect when something is wrong,
Mm-hmm.
and then they trigger an inflammatory response.
Okay.
And this inflammatory response can help to kill cancer cells.
Mm-hmm.
So if ivermectin can trigger inflammasomes in cancer cells, that would also be a good thing.
So it's interesting. It sounds like it's not just...
It's multi-pronged.
Yeah.
It's working on multiple levels,
Okay.
which is really exciting because, a lot of times with cancer treatments, they're very targeted towards one specific thing.
Right.
But if this is working on multiple levels, that's really promising.
Yeah. So, are there any, is there any evidence that this is actually working in humans?
So there was a really interesting anecdote that Dr. Campbell shared.
Okay.
It was from a Dr. Kathleen Ruddy,
Okay.
who's a cancer surgeon in the U.S.
And she had a patient named Paul
Okay.
who had stage 4 prostate cancer.
Oh, wow.
And he had exhausted all of his conventional treatment options.
Right.
There was really nothing left for him to do.
Yeah.
And so he decided to try ivermectin.
Okay.
And what's really remarkable is that his PSA levels, which are a marker for prostate cancer,
Right.
dropped significantly after he started taking ivermectin.
Wow.
And his overall health improved.
That's amazing.
Yeah, it's a very compelling story.
Yeah.
But of course, it is just one anecdote. We need more evidence.
Yeah.
We need clinical trials to really confirm these findings.
Yeah, but it's definitely promising.
It's very promising.
And I think that's what's so exciting about this is that, even if it's just one anecdote,
Right.
it gives you hope
It does.
that maybe there's something out there
Yeah.
that can help people who are, dealing with these really difficult situations. And especially, I think it's important to point out that ivermectin has a very good safety profile.
Right.
It's been used for a long time
Mm-hmm.
to treat other conditions. And
Right.
so it's generally considered to be a safe drug.
Yeah.
So for patients who have exhausted all other options,
Right.
it might be something that they want to consider discussing with their doctor.
Yeah, for sure.
But obviously, more research is needed, but it's
Right.
definitely a promising avenue.
Yeah, and it's interesting, too, because the paper mentioned that it might be effective against a wide range of cancers.
Right.
They listed breast cancer, digestive system cancers, urinary, blood, brain cancers. It's like a whole
Yeah.
long list.
It's very broad.
Yeah.
And I think that goes back to what we were talking about earlier about how it's working on multiple levels.
Mhm.
If it's triggering apoptosis, autophagy, and inflammasomes,
Right.
then it's conceivable that it could work against a variety of different cancers.
Right. So it's not just targeting like one specific type of cancer.
Exactly.
It's targeting the underlying mechanisms that cause cancer,
Yeah.
which is really fascinating.
It is.
And then Dr. Campbell also talks about this idea of creating patient cohorts.
Yeah.
And I think this is really important because, a lot of times when we're talking about new drugs or new treatments,
Right.
it takes a really long time to get them approved.
Years.
Yeah.
Years and years.
And it's really expensive.
Very expensive.
And so this idea of creating patient cohorts where you're basically just gathering data from people who are already taking ivermectin
Right.
and seeing how they're doing.
Exactly.
It seems like a much more efficient way to gather data.
It's a real-world evidence,
Yeah.
and it's much faster.
Yeah.
And it's much cheaper
Right.
than doing a traditional clinical trial.
Mm-hmm.
So I think that's a really promising avenue.
Yeah.
And, of course, there are always ethical considerations.
When you're doing any kind of research with humans,
Yeah.
but I think if it's done properly
Mm-hmm.
and with informed consent,
Right.
then I think it could be a really valuable way to gather data.
Yeah, I think it's interesting, too, because Dr. Campbell brings up this point that, ivermectin is a very inexpensive drug.
Yes.
It's readily available.
Very readily available.
And so if it were to prove effective in treating cancer,
Right.
it could potentially make a huge difference in how we treat cancer,
Yeah.
particularly for people who might not have access to expensive therapies.
Absolutely. It could be a game changer
Yeah.
for a lot of people.
Yeah. And then he also makes this kind of controversial point, which I think is worth discussing.
Okay.
He suggests that there might be resistance from pharmaceutical companies.
Right.
Because if ivermectin were to prove effective in treating cancer,
Yeah.
it would mean that they would lose a lot of money.
Right. Because they're not making money off of ivermectin.
Right.
It's a very inexpensive drug.
Yeah. Yeah.
So there's not a lot of profit to be made. Right.
And so they might be hesitant to fund research into ivermectin.
Yeah. And I think that's a really interesting point because it kind of makes you question,
Yeah.
the motives behind some of the research that's being done
Right.
and, whether or not we're really getting the full picture.
Yeah. Something to think about.
Yeah. So overall, this has been a really fascinating deep dive.
It has.
I think the takeaway here is that while more research is definitely needed, the potential of ivermectin as an anti-cancer treatment is definitely something worth exploring further.
Absolutely. And I think it's a good reminder that, we should keep an open mind
Mm-hmm.
and be willing to explore all options,
Yeah,
even if they're unconventional.
right. Because sometimes the answers are in the most unexpected places.
Exactly.
Yeah, so I think that's a good place to leave it for today.
Yeah. Thanks for having me.
Yeah, this was great.
It was fun.
Yeah.
Yeah.
All right. Thanks, everyone, for listening.
Take care.
We'll see you next time.
Bye-bye.